Good evening, everyone. Welcome to our Sincere Healthcare Group Facebook Live. We have Professor Chye, a fertility specialist with the title of the father of IVF in Asia, as he created and delivered the first IVF baby in Asia back in 1983. And today, Prof. is with us. So for today's topic, we will be talking about understanding your fertile health, and it is common for couple to only discover they have a fertility issue after they have tried to get pregnant unsuccessfully for a year. And so, Prof, can you help us to have a better understanding of is infertility a male or female problem?
Yes, definitely. It's actually a combination of male and female problems. Generally, it's about 50-50. And there is a group of infertility that is what we call idiopathic. That means we do not know the cause. The normal investigation for both male and female turn out to be all the investigation not turn out to be normal, so we cannot pinpoint the cause as to whether it's a male or female problem, and that group maybe occupies about 1/3. So the other 2/3 are combination of male female or male or female. So again, the other 2/3 can be divided into 1/3, 1/3, 1/3. So 1/3 due to the male, 1/3 due to female, and 1/3 due to combination of male and female.
I see. So for couple who are newlywed, and is it important for them to get an infertility evaluation now, or should they wait for a period?
I think it depends a great deal on the age of the female and the urgency, or whether or not they have any predisposing factors. What do I mean by that? The most common predisposing factor would be irregular menses of the wife or of the lady. When there is irregular menses, usually there is a problem for ovulation. If the male has had a sperm test done before, which shows some abnormality, then of course it's also wiser to start the treatment process early.
And what are specific tests would you recommend to understand a patient's fertility health?
Okay, for the male, it is usually just a sperm test, yeah, and of course, the sperm test by itself may not be adequate, because we also do what we call the sperm function test. So the normal semen analysis just look at the normal parameters like the density, the motility, the shape of what we call normal forms. But that doesn't tell whether or not the sperm is able to attach to the egg, or whether or not the DNA is normal. So for if one needs to look into more details, or look into depth as to what is the cause of fertility, then we will do that. So for the female, the most important, of course, would be the egg reserves. So the way to tell whether the patient has got good egg reserves is by doing the blood test called AMH, or anti-Mullerian hormone. That gives us an indication of whether she has got good number of eggs or not. If she has good number of eggs, then it is perhaps better prognosis. But if she has got low number of eggs, then there's some urgency, because she may reach menopause earlier.
And is infertility become more common in recent years?
Yes, whilst we don't have a definite, proper study or a report to show that the incidence or the prevalence of infertility is more common now. It is a general belief worldwide. It's a global phenomenon that infertility is becoming more common. Maybe it's related to the modern society, and the environment, the contamination. There's so many factors.
And is infertility and what causes infertility?
So for the female, there are many possible causes. The classical textbook approach, of course, is ovulation, and whether or not the tubes are blocked, and other factors like endometriosis. These are the more common ones. Then there are rarer forms like anatomical defects. Yeah. But the more the unrecognized causes, I think, are even more important, because especially in the iatrogenic group, there may be influences like I mentioned earlier, from the environment, the pollutants, the food that we take. For those who smoke, even the females who smoke, it will definitely affect the quality. So all these will have an impact on the eggs and the quality of the eggs. If the egg quality is poor, then of course the resulting embryos will be poor, and the chance of pregnancy will be lower. And for the male also, the same situation. The major cause, of course, would be the environment, especially if the male smokes. Even passive smoking can have a problem. So the diet, there's so many causes, because many studies have shown, particularly those studies that look at the sperm quality in sperm banks. The sperm banks will normally have sperm donation from healthy young males. So this will be a benchmark, and since the sperm banks have been started many decades ago, at least 3 to 4 decades ago, over the years, it has shown a declining sperm quality, and this is due to the environment.
So does age affect infertility?
Yes, definitely. The age impact on fertility is worse in the female, because the female reaches menopause by 50. So by age of 40, the chance of pregnancy is definitely much lower. And the decline actually starts earlier, maybe 35 years old. You can see an obvious decline. So for the female, the increasing age of marriage and the increasing age at which a woman gets her first baby is definitely a bit worrying. Long time ago, females are encouraged to get married early and have their families early, and that was their main duty. But now the modern female is very different. The modern female has got their own career to look forward to, their own plans in their career. So they put aside marriage, they put aside having a family. So all this will definitely affect. Of course, these are social norms now, but so it is difficult to say that you have to reverse it. So how do you overcome this declining fertility as a woman ages, but yet wants to ensure that she has the chance to advance herself in her career? The only way is to freeze her eggs when she's younger, less when she's 30 years old, 35 years old. Egg freezing can be done, and that will preserve the future fertility. So by the time she reaches 40 years old, when she finds Mr. Right, or when she decides that she has advanced sufficiently in her career and she wants to get a child, she can call upon those frozen eggs, and the chance of fertility will be much better. Usually, if she were to freeze her eggs at 30 years old, fertility will be maintained at around 30 years old.
And does stress also cause infertility?
Yes, it does. Stress, different people have the ability to overcome or to get used to stress. Yeah, some patients great deal of stress needs to be applied before the effects become obvious. But some patients, even a bit of stress, and they are overwhelmed by it. So of course all this will have a psychological effect, yeah, and it will definitely, for the female, it will definitely affect ovulation. We know it's a common phenomenon around examination times, especially major exams. The females will have very irregular menses, they go into long periods where they just don't have menses, yeah, and this all due to stress. For the male, the stress effect usually not so severe, but not enough studies have been done in the male. But we don't think that it is so bad, because the male produces a lot of sperm continuously. So even when there's a period where sperm production is reduced due to the stress, when the stress is over, the sperm production increases again, and hopefully it will negate this effect, because the common pool will be much more.
Can infertility be prevented?
Yes and no. Definitely, infertility due to age cannot be prevented unless you take special steps, like in the female to freeze the egg. For the male, age is maybe not so bad, because males have been known to have children even when they are up to 60 and 70 years old. So sperm production continues. They do not have a similar episode like in the female having a menopause. Of course, there is an andropause, but that is more hormonal and not so much infertility. Yeah. So yes, under those circumstances, those situations can be prevented, because you can take steps to overcome, like egg freezing, even sperm freezing. Long time ago, in times of war, before the young male goes to battle, they freeze the sperm. Yeah, so this is a form of prevention. There's some continuity of the family line, or if the male gets so severely injured that he cannot have a family, at least he can fall upon the sperm that's available in the sperm bank. Yeah. What about the other preventable factors? Yes, good. Make sure you have a good diet. You don't abuse yourself, like drug abuse and all kinds of abuse. Yeah, live a good life, a healthy life. Make sure that you have enough sleep. Yeah, so all this will definitely help. Some form of exercise. If you don't keep yourself healthy and become overly obese, then it will also make it worse. This is particularly true of the female because obesity is associated with anovulation and infertility.
So can infertility be cured?
Yes, of course. If the woman has got polycystic ovarian disease, for instance, you can take medication that will correct the severe hormonal disturbances in polycystic ovarian disease. Most of this temporary, you cannot have a permanent cure. So the doctor will be the best person to advise. If the woman has got, say, endometriosis and that's the cause of infertility, of course she can have treatment. Again, like I say, it cannot be permanent because endometriosis will keep on recurring. Tubal disease, obstructed tubes, you can try to do surgery to release the adhesions that cause the tubal blockage, but this is not so effective. So for tubal disease, the best of course is to do IVF, where you bypass the tubes completely. Yeah. For the male, where there's no sperm at all, what you call isospermia, if the sperm is available in the testes, you can do an operation to collect the sperm directly from the testes, and then do IVF because the sperm will be very weak. You cannot use the sperm for IUI or for any other purpose. So you just have to use the ICSI. You have to take the sperm and inject directly into the egg. But we have many babies born as a result of that. So it's okay.
And if a couple that had given birth to a baby before, and can the patient still be infertile now?
Yes, there is a condition called secondary infertility where the woman has got a pregnancy before. The pregnancy may have ended normally in the birth of a child, or may be prematurely terminated, like in miscarriage. This indicates that the woman is able to get pregnant. So in terms of the biological system, and we know that the female can carry a child, especially if she had delivered one before. Certain conditions, like polycystic ovarian disease, after the woman delivers and breastfed, the system may undergo a reset, and the patient may actually be able to ovulate properly, and the polycystic ovarian disease may be overcome. So, but this is not that common, yeah. But yes, we have a number of patients who have become, who are able to get pregnant on their own subsequently to a delivery from infertility treatment.
Okay, thank you, Prof. And finally, we are coming to the end of our Facebook live section, and we appreciate Professor for making time to our show. For future Facebook live video, do follow us on our Facebook page at Sincere Healthcare Group. Thank you.
You're
Thank
most
you.
welcome.
Thank you.
Thank you everybody for tuning in.